let me ask a series of questions. I'm going to ask 5 questions and you can answer them. This is from Beth Lambert's book, A Compromised Generation. The number of prescriptions purchased from 1993 to 2003 grew 70%, while the U.S. population by only 13%. Furthermore, Americans use more pharmaceuticals than any other nation in the world. Mm-hmm. So the questions I want to ask is this good or bad that we use so much medicine, and why? Is it helping or hurting our health? Are antibiotics to be avoided? How do we create or lose healthy bacteria balance in our gut, and why does this matter? Are there herbal alternatives to pharmaceutical drugs? Are there herbal antibiotics that can be used? So respond to those 5 questions.
I can't wait to hear the herbal part because I've moved myself out of the pharmaceutical, not that it was ever really that way, but into the herbal in such an empowering thing to know that there's a whole arsenal of tools that are not coming from the pharmaceutical industry. But to answer or address what you just said there, we are so convinced that pharmaceuticals are the answer. As a culture, and I'll tell you where it started, or I'm convinced this is where it started. When you had the advent of sulfa drugs and then later the antibiotics and all the various antibiotics after World War II, that experience that this culture went through, which was you had somebody who was dying of tuberculosis, and he was going to die, but then he took this one pill, and up the next day, he was plowing his field, miraculously recovered from one pill. That had such a powerful impact on our imagination that a pill could be a life-saving, life-altering, life-changing experience. One pill. That's what antibiotics did for us. And antibiotics are a very important discovery, and I'm certainly glad we have them, but they are used and abused like nothing I've ever seen before in this country. We prescribe them for everything, and for things they don't even work on, like viral sore throats. Major problem. There's a whole series of pharmaceuticals that are a problem. Antibiotics, in my opinion, are the biggest problem because taking antibiotics, especially the broad spectrum antibiotics, is like carpet bombing your gastrointestinal tract where your microbes live. And like you addressed, that's your immune system. So when you take an antibiotic, you kind of carpet bomb your immune system. It's like napalming your immune system. But antibiotics are not the only class of drugs that do that. You have drugs like proton pump inhibitors or the H2 antagonists, which are the reflux medications that, by the way, they are prescribing to babies at 2 and 3 weeks old because the babies have reflux. And do you know why the babies have reflux? Because they're sensitive to the foods that are going into the mother and to the breast milk. So the babies are having sort of an allergic kind of reaction. But the doctor says, oh, that's reflux. Here's reflux med. Problem with that is it alters the pH in the gastrointestinal tract, which alters the ecology of the microbes that can live there, which then downstream impacts the immune system and on and on. Hormone and steroid medications, NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and Advil, that class of drugs, birth control pills, and all these other kinds of asthma medications that are in that steroid class, those all impact the microbiome. And all can be devastating to your health. So that was my 2 cents on how damaging I think pharmaceuticals are, and this is coming from somebody who used to work in the pharmaceutical industry. I actually did work for a period of time for pharmaceutical companies. I think there are drugs that probably have a purpose, and I'm not saying we should wipe all pharmaceuticals off the planet. I don't think we need to be that drastic, but I'm telling you, for everyday routine illnesses and for chronic illnesses, the pharmaceuticals are not necessarily the way to go. And I would love to hear what you have to say about the herbals, because I think that's such a great alternative path.
Well, I am also glad that we live in a time where antibiotics are available. They can be life-saving, but very often when we have an illness, rather than starting with drugs, and if that doesn't work, surgery, like take your tonsils out if you're getting frequent sore throats. There's so many other options. And one is, are there any other emotional components going on? Maybe, kids are having earaches because there's a lot of fighting going on, or bickering, or door slamming, or loud rock and roll or something.
Eating dairy.
Absolutely. And then, so you look at, are there any emotional components? And then you look at food. How can we improve diet? And then there are so many herbs that can really help fight infection. The word antibiotic means against life. They're the opposite of a probiotic. So we do have herbs that can fight infection. There's many of them, but echinacea is more of an immune stimulant. It stimulates white blood cell production, but we have oregano oil, we have this isatis, andrographis, garlic. You know, I really love the idea of something that's available in every home, in every kitchen around the world, and garlic is certainly one of those. It's a bronchodilator. I've used it for asthma. There's also homeopathy. You know, if you zero in on what's the right homeopathic remedy, you might find that allium cepa works for a cold. So I think we've given the power of our health over to someone else rather than taking responsibility for it. It's not our doctor's responsibility. There can be helpers out there. It's not our acupuncturist's responsibility. It's really up to us to love and care for ourselves and do what we can and not wait till there's a disease, but how can we prevent these things so that we don't end up in a desperate situation? So.
Yeah, the statistics are stunning. I mean, you know, the United States of America, we have 5% of the population. We take 50% of the medicines on the planet Earth. So we only have 5% of the world's population. We take 1/2 of the pharmaceutical drugs on the planet. And repeat the statistic that you told us before. Since the last 20 years, it went up how many times?
Okay.
7?
Yeah.
What he just
Yeah.
Let me read it, hold on.
Yeah, it was actually surprising to me. It was higher than I thought.
And you know that the second largest consumer of pharmaceuticals is Japan, but they only consume 9%.
Yeah.
So think of that. Think of that difference.
50, they go to 9.
Yeah.
Then of course, Japan produces a lot of pharmaceutical drugs. Germany is in that list, produce a lot of drugs. France and Switzerland produce a lot of drugs. And 80% of the people on the planet, they do not take pharmaceutical drugs. What do they take when they get sick? Herbs. They take natural medicines.
And food.
And food,
And
that's right.
antidepressants, we take.
Oh.
We take most.
You know, it's so crazy for us to see in the short time we've been in our work that you couldn't find a psychiatric medicine 2-3 generations ago. If you had any depression or more serious concern, they'd put everyone on lithium. And then all at once they found out this was a watershed economic landfall for them. And so now they've convinced the world's population that have money, not everyone else, just the people who have money, you all are depressed and you need psychiatric medicines. It used to be exclusive to psychiatrists, maybe some psychologists. Now general practitioners who have no training in psychiatric concerns basically are the biggest distributor of antidepressants. And by the way, more antidepressants are prescribed than antibiotics. Now think of that, how shocking and stunning and outrageous that is, that we actually have convinced everyone that they need antidepressants. 8 out of 10 people we work with who have been told they have cancer are also put on antidepressants by their doctor. They think it's part and parcel. And so this is destroying the health of human beings. It has taken the heart and the soul out of healthcare, the empathy and the compassion out of healthcare. And I think if the doctors had proper training about health, they know little to nothing, the general doctor who went to school for the right reason, wants to help people. They don't know much about health at all. They know about prescription filling. And it's not that easy. You can't just prescribe pills. But the truth of the matter is, I'm not against pills. I think there's a time and a place. It's the overuse, misuse, and prolonged use of these pills.